The U.S. healthcare system ranks last among other major countries for quality, access, and efficiency, according to two studies released Tuesday by the Commonwealth Fund, a healthcare think tank. They found that the United States, which has the most expensive healthcare system in the world, underperforms relative to other countries. I'm Dr. Jacqueline Witherspoon, and we will explore the issues surrounding healthcare in America compared to other countries on this edition of The Professors.
From across the city and the 7 city colleges of Chicago, broadcasting from 63rd and Halsted at Kennedy King College. Professors take the art of conversation to a higher degree.
45 million Americans, or 15% of the U.S. population, have no health care insurance. The United States is also far behind in adopting modern healthcare information technology, which translates into spiraling costs and poor care. Many major countries besides the U.S. seem to believe that every human being has a right to health care. To help us discuss this fundamental difference, we have invited professors: Dr. Christy Davis from Olive Harvey College, Max Golias from Truman College, Jonathan Helwink of Wilbur Wright College, and Dr. Mary Maryland, President of the Illinois Division of the American Cancer Society and a founding member of Congressman Danny K. Davis's 7th Congressional District Healthcare Task Force. In his new book, The Healing of America, A Global Quest for Better, Cheaper, and Fairer Healthcare, veteran foreign correspondent for the Washington Post, T.R. Reid, states, "As Americans search for the cure to what ails our healthcare system, we've overlooked an invaluable source of ideas and solutions: the rest of the world. All the other industrialized democracies have faced problems like ours, yet they've found ways to cover everybody and still spend far less than we do. How can we improve our healthcare system?" Let's begin with Dr. Maryland.
There certainly are opportunities for us to look at improving healthcare system in this country by looking at best practices in other countries. However, there are some parts of the healthcare system where we really do an excellent job. If you think about cancer, we have made significant progress in decreasing the rates of cancer compared to, say, a country like Australia, where in general they have low cancer rates, but absolutely terrible cancer rates in relationship to melanoma. Obviously, that's part of the reason in their relationship to the sun. However, a public education campaign might have an impact there. So if we were to look at what works globally, we could look at some other efficiencies and in information technology. As you know, many of our residents go to the emergency room for care, but emergency departments are starting to use technology, go paperless, and that's a way that we can save some money as well.
That's true. It does cut down on repeat care to the same individuals.
And we're also dealing with a crisis of efficiency, which unfortunately the debate so far just seems to have just overlooked. I mean, 20% of the amount of money that's spent on insurance, at least the money that's actually spent on insurance, doesn't go to health care coverage at all, which is, compared to other industrialized nations, is far, far higher than our international competitors.
I think 2 points here. First of all, I think healthcare is, at least in the 21st century, a human rights issue. I think much of the world views it that way, and I think as our understanding of what a human right consists of evolves, I think we will come to the conclusion that healthcare is included. In regards to comparing and contrasting other countries and trying to, I suppose, transplant some of their practices, best practices, as you say, here in the United States, I think one of the difficulties, if not one of the greatest difficulties, is capacity and size. When you think of a country like Taiwan, which is one of these countries that went around the world, did a study to see which system works best, that's a country of 23 million people. One of the most recent countries to adopt a universal type system is Switzerland. There's 7.5 million people in Switzerland. One of the countries that is held up as one of the models of a fair and just healthcare system, Norway, has roughly the population of the Chicagoland area. There's more people in California than there is in all of Canada. So one of the difficulties here is approaching the problem on this size, 300 million people. That there's no model for that in other places.
And that's a good point, Jonathan, because many things are in research areas, they function well in a petri dish, but when you try and apply them to real life, they just don't work.
And one thing that I totally agree with Jonathan is the fact that health care should not be something that's optional. Everybody should have health care. And when we think about that issue, I believe that sometimes with the expenses, going back to you, Max, with the expenses, I think about malpractice lawsuits.
Yep.
That is one of the most highly growing problems in regards to healthcare as well. And so when we think about that, we may assume that money is being spent wisely here, but at the same time it's being taken away somewhere else when we think about the malpractice lawsuits. And it's almost like a trickle-down effect because, again, even with the expense, looking at that picture, then we look into when people are filing bankruptcy. Most people are filing bankruptcy also related to health care.
Much higher than other industrial nations
Much,
as well.
much higher.
And tort reform is always a major component of conservative efforts to try to reform health care, which is important. But if we bring down the costs of health care, tort problems seem to be able to dissipate. You don't have the same kind of malpractice suits in other nations with more comprehensive care as a result of the kind of lowering of costs which can happen if the government is running insurance companies like a utility, let's say, or the healthcare system like a utility, much like they do with Medicare, frankly, or with Veterans Affairs, very popular health insurance programs run by the government exclusively, highly efficient and very popular even amongst those who would generally be opposed to healthcare reform. So these are the kinds of things that can evolve with a lowering of healthcare costs, which a public option would do, which is what the Obama administration is forwarding, and that's the reason why they're opposed to it, because that kind of competitive option of a public option would lower the costs. People would automatically see the comparison of the costs for coverage and evolve in that direction. And they're seeing that 10, 15 years down the road, their particular niche on the market will go away
and
with
across,
good reason.
Across the globe and across all of these countries that have national healthcare systems, costs are just rising. And the reason the costs are rising is technology. As technology increases, the price of healthcare will continue to grow. Now, that doesn't mean that the system here is fair. It certainly isn't.
Cost is only one of the issues, though. I think if we consider quality, accessibility, you spoke earlier about the administrative overhead. So I think each of those represents opportunities for us to have some cost efficiencies, and the freeing up of those dollars would be available to indeed provide direct services. And the American Cancer Society is very aware of each of those areas and thinks that there are things that we can do right here in this country to get our dollars to serve the public more.
But it's interesting what Jonathan said too about technology. And research and development is a major reason why pharmaceutical companies simply have very, very high costs. So research has always been, and development has always been, pricey. Part of the reason why that's the case is because of the insurance issue. The companies are worried about of giving away drugs, obviously, that won't work. They need to have coverage. They need to have protection against countersuits, and therefore the constant increases continue. The problem with the debate so far that we've had in this country in the last few months has been that this particular status quo has been the starting point. People don't realize that in other industrial nations, with the particular problems that I agree with Jonathan rightly described, with those challenges in mind, these industrial nations have actually been able to really curb these costs and these problems as a result of having a public option or government spending or government insurance or some combination of both, as they have in Germany. And so we have so many problems that are in place now that's creating so much fear. But the very cure that we're dealing with, a potential government-run health insurance, would actually cure those problems, cure those ills, as it were, and that's the very thing that people don't seem to be able to really realize.
Now, let me ask: is litigation in general a problem specific to just U.S.?
It would seem like it. I think the easy answer to that question is yes, but it isn't. I mean, it's a component. Whenever you have a free market system, as most of the countries we talked about have, you're going to have civil courts adjudicating certain kinds of decisions that based on malpractice.